Dr. Harvey Lui, our guest, he's a dermatologist, oncologist at the BC Cancer Agency. He's also the program director at the Vancouver Coastal Health Research Institute. He's a Harvard grad. Much has changed since you went to Harvard, I'm sure.
A lot has changed. It's 20 years, we've learned a lot of new things about the skin, definitely.
And how to discover cancers and how to prevent cancers. Absolutely. So the melanoma, that's the bad one.
Melanoma is the most serious skin cancer. It's the one that can spread and metastasize and kill you, actually.
If you have a melanoma, you have it taken off, how do you know if the doctor has got it? It's gone.
Good question. Well, what we know is whenever we remove a melanoma from the skin, we always send that skin tissue, all of it, the entire specimen, to the lab. It gets sliced and diced up in detail, and it's looked at microscopically, and then the pathologist can tell us, okay, you've got it or you haven't got it, and if you haven't got it, they say, okay, go back and cut some more tissue out. So using the combination of a surgeon and the pathologist, we can be pretty confident whether we got it.
Okay, so essentially the melanomas or these others have tentacles? What's going on underneath the skin?
Well, it's like a plant, right? You know, the part of the plant you can see above the surface, above the soil, is, you know, the stems and the leaves, but there's roots. And so same thing with melanoma. We can see on the surface of the skin, you see this brown or dark spot, and then under the skin, there are roots to it, and that's how it spreads. And if the roots end up reaching the lymphatics or they reach the blood vessels, then that's how it can spread to other parts of the body.
Okay, and could it be something that you've had all your life on your skin and suddenly turns dark, or does it just appear?
Both. So in some cases, melanoma can just come out of the blue, and probably about a third of cases, the melanoma seems to grow out of a pre-existing mole on your skin.
Okay, and why does it spread?
Why
What's
does
that
it,
about?
Well, you mean, well, it can spread in two ways. Either spreads right on the surface of the skin because the cells are growing and multiplying, or the cells can reach down, and as they're kind of digging into your skin, if they reach the blood vessels, they reach the lymphatics, or they reach the nerve tissue, then they can spread along the blood vessels or along the lymphatics, and that's when it becomes very serious.
Very serious. It goes into what? The lung, the
Anywhere
liver?
where the blood goes is where the cells, those melanoma cells, could potentially travel.
And at what point will it metastasize, or do you know?
We know that the thickness of the melanoma, so when the pathologist is examining the melanoma under the microscope, he can look at how thick the tissue is, and the thicker the melanoma cell layer is, the higher the chance of metastasis.
Okay, so your doctor or oncologist or dermatologist can pretty much tell you this is an extremely serious melanoma or not so serious. They're all serious, but
they're all serious,
you know
but
what
yeah,
I mean.
there's ranges
this is
of
likely cured. You're done with this.
Exactly. So if you have a very thin melanoma and we can measure that, then we say you've got a low risk melanoma, you know, and you're probably going to be okay. You need to see us regularly. Or if you have a high risk, a thick melanoma, then we may need to do some more surgery. We might actually need to do additional surgery to the lymph tissue or something nearby.
Okay, lymph tissue. What about radiation?
We would consider that in the cases where the melanoma has already spread. So when it's beyond just the skin, then we have to think about other methods.
And chemo involved here at all?
Chemo can be involved, but the chemo isn't that great. Radiation can work, but the best, obviously, is to treat it when it's thin, when we can cut it out, and that's all you need. And that's why early detection is just so critical for melanoma.
Very much so. So if you have a partner, ask your partner to check your back, because as you know, it's hard to see.
Exactly. Well, that's one of the many advantages of having a partner.
Well, and you hear that a lot. You know, the partner says, you know, whatever you've got on your shoulder doesn't look good.
Exactly. And we have, especially with men, a lot of my male patients with melanoma, it's the wife or the spouse or the partner who's kind of nagged them to come in. And thank God for that.
Genetic factors in melanoma?
Yeah. Certain people have melanoma running in their families. And so if you're one of these people who are in a melanoma-prone family, you need to be checked out more regularly, and you need to get your relatives checked out, you know, your immediate family members.
Sure. Skin color, melanoma connected?
Yes, to some extent, but it's an equal opportunity disease. Anyone can get melanoma, really.
Okay. Squamous cell carcinoma, occasionally named squamous cell something else. I'm not
SCC,
sure.
sometimes.
SCC.
Yeah.
Exactly. What's that?
Squamous cell carcinoma is a form of skin cancer.
Now, if you had that, you'd notice.
You'd notice, but you'd be surprised. Some people ignore it and some people deny. It shows up as a solid growth on the skin. It might look like a little volcano on the skin. It's just kind of erupting on the surface. It's a hard lump. It might be scaly. It might be rough. But it often can develop fairly quickly within a matter of a few weeks to months.
And it could be on your elbow, or it could be somewhere else, or what?
It could be anywhere on your skin, but we're especially worried about, or especially seems to show up on areas that have had a lot of previous sun exposure.
But what about internally?
Well, squamous cell carcinoma can occur internally, and any organ can have squamous cell carcinoma, and in those cases, it's usually not associated with sun exposure. It's associated with other factors, like smoking or excess alcohol intake.
Really?
Yeah.
HPV?
HPV can be affected as well. Sure.
HPV can cause this, a squamous cell? I was just reading up, and I'm not sure, but...
HPV is one of the factors.
Human papillomavirus, which 80% of people have.
Yeah, it's related to the wart, the common wart,
right.
Except certain strains of wart virus have a chance of causing, increased chance of causing skin cancer.
Really?
Yeah, and it occurs more in the genital region in general.
Or in the anus, or?
Yeah, anywhere in that area, below the belt, so to speak.
Below the belt cancers can be connected to, I had one, and they said, my oncologist said, this should be on your elbow, but it wasn't. So they found it with a colonoscopy.
Yeah. Well, it just proves the point that anywhere you have skin is anywhere that cancer can develop.
But there's no sunlight up there.
There isn't, but there are other factors, HPV. It depends. I don't know if you've been to Wreck Beach lately.
Well, that's true. That's true. But what you said, alcohol, smoking, how does that affect any skin cancers?
Well, I'm talking about internal cancers.
Oh,
so
internal cancers.
Internal cancers. But in terms of smoking, we know that smoking actually makes your skin look old.
Sure.
So if you need another reason to stop smoking and you'll look younger.
I think that would be a great campaign, and I know they've had a few in the past because we're vain, and fewer wrinkles is a good thing for most of us. So if they remember, they had that one ad with the wizened up old monkey smoking, and you thought, ooh, don't want that to happen to me. What about prevention? You said stay out of the sun. Are there vitamins you can take?
There's a lot of interest in vitamins and antioxidants, and a lot of research is being done on that, but we're not quite so sure that is, we can make a general recommendation. We can definitely make a general recommendation about behavior and using sunscreens.
Sure.
And we also know that if you have photo-damaged skin or sun-damaged skin, if you use topical vitamin A derivatives, you can actually make your skin look younger. And that's scientifically proven without a doubt.
Well, that's good to know too. Now, tell me about this new device. I know it's not on the market yet or not in the medical circles yet. It's called a Verisante Aura. What is that?
Well, we've been doing research probably the last 15 years at the Cancer Agency, and we're, 1 in 5 Canadians is destined to get skin cancer. And so that's a lot of people that need to be evaluated and examined by physicians, general practitioners, nurses, dermatologists. And so it becomes very complicated, or it's a huge number of patients to examine. So we're trying to figure out, is there a better way, an additional way that using a device or using technology to help us find these cancers more efficiently? And now, after this many years of research, we've actually developed and invented a device that we think is going to be useful in the clinic.
Well, it looks like a trendy vacuum on the screen. I'm not sure, but anything that you can discover cancer before it gets you. Get it.
Yeah, and the idea here is that we use our eyes to diagnose cancer. We see it, we examine it, patients recognize it with their vision, and it turns out that there are additional optical signals that we can't see with our naked eye, but this device, this Aura, the Verisante Aura, can actually pick up these optical signals, and there are different optical signals for cancer that we can detect and give us a determination as to whether a given spot is more or less worrisome for cancer.
So preventive tests inside, if you have an inside skin cancer somewhere in your body, are there certain tests we should all have, like pap smears or colonoscopies, or is it that connected at all?
Well, skin cancer, we can detect simply by looking at the surface of the skin. So all these other cancers, colon cancer, cervical cancer, lung cancer, those are not necessarily related to skin cancer, and there are good screening techniques available, and you know, you'd need to consult with your family physician for those.
Sure, okay, but of all these cancers, the basal cell, the melanoma, the squamous, which one does not metastasize?
The one that does not metastasize is basal cell carcinoma.
Okay.
Yeah.
The squamous cell can?
Squamous cell can, and so can melanoma.
Okay, melanoma more likely than squamous cell?
Correct, yeah.
Okay, nice to see you.
Nice to see you
Thank you
again.
for warning us. Dr. Harvey Lui, dermatologist, oncologist at the BC Cancer Agency.